Everyone. We're going to have a reading from book one of the updates on the fundamentals of general medicine, the book one of the BCSC series of the American Academy of Ophthalmology books. Basically, this is about Sjogren syndrome. Sjogren syndrome is a chronic autoimmune disorder, basically characterized by lymphocytic infiltration of the exocrine glands. It can occur as a primary disease alone, or as a secondary occurrence in a secondary form linked with other autoimmune disorders, especially, for example, rheumatoid arthritis, systemic lupus erythematosus, and also systemic sclerosis. This syndrome basically presents at any age, and it's irrespective of sex. It has no sexual preponderance, although basically the women, if you kind of assess in their fifth and sixth decades of life, they are more commonly affected. But those out of that age range, they basically has no sexual preponderance. And typically the symptoms include dry eye, and also dry mouth and the dry skin. So there is dry eye, dry mouth, and dry skin, or xerosis. And the ophthalmologist basically may be the first physician to see these patients of Sjogren syndrome because of their ocular symptoms, the dry eye syndrome, basically. And there is something very important that is outlined in American Academy of Ophthalmology, the Mikulicz syndrome. Basically, this entails a parotid and lacrimal gland enlargement associated with Sjogren syndrome. If you have parotid and lacrimal gland enlargement associated with Sjogren syndrome, this is the Mikulicz syndrome. And it can occur in more severely affected individuals of the Sjogren syndrome. Here, you have parotid and lacrimal gland enlargement. Then the patients basically with the primary form of the Sjogren syndrome, they may have a number of other systemic manifestations. For example, they could have upper airway dryness. They could have a mucus plug development as well. They could have purpuric vasculitis as well. They could also have hyperglobulinemia as well. And although about 50% of these patients report symptoms of arthralgia, the joint pains, also arthritis is quite less common here. Arthralgia is common, but arthritis is less common. The pain is there, but the inflammation is less common. Now, and some patients also may have subclinical inflammatory myopathies as well. And mild anemia across all the cell lines has also been found in approximately 20% of these patients of Sjogren syndrome. And the overall risk of the non-Hodgkin lymphoma is also increased in these patients of Sjogren syndrome. And it's also said that central and peripheral neurologic involvement may also be present in the patients of Sjogren syndrome and may mimic multiple sclerosis patients or even patients with psychiatric disorders as well. The American College of Rheumatology and the European League Against Rheumatism basically recently updated their classification criteria for primary Sjogren syndrome, and they were basing it on 5 objective measures. These objective measures basically included specific findings on the labio-salivary gland biopsy, and also on the presence of anti-RO antibodies, and also ocular staining, and as well as abnormal Shammas testing. And also they also included the other criteria in their list is the reduced unstimulated salivary flow, if it is reduced. So those are the main 5 objective measures they included in their criteria. The benefit of a minor salivary gland biopsy basically is to confirm the disease of Sjogren's disease, to rule out other disease processes, for example, sarcoidosis or amyloidosis, and this is basically to serve as a prognostic indicator for the development of future lymphoma in the patient who has Sjogren's. And basically the serum level of FMS like tyrosine kinase 3 ligand, which is FLT3L, also shows a promise as a potential predictor for the development of this malignancy. Ongoing research is still happening and is directed at finding the key biomarkers for Sjogren syndrome to provide a more sensitive and specific testing for this disease, which is quite a very uncomfortable disease. So among those being studied, basically the profilin and also carbonic anhydrase 1, CA1, in saliva, and as well as cathepsin S in the tears. These are quite the biomarkers that people are studying right now. The treatment basically is aimed at relief of the symptoms and substitution or supplementation for reduced or absent secretions, because you had dry mouth, dry skin, dry eyes. So basically you're replacing the or supplementing the reduced or absent secretions in there. You give the artificial tears. So also there's a role of immunosuppression, which may be necessary in some patients with systemic manifestations. Thank you very much. This is what I had for Sjogren's syndrome.